important healthcare decisions every day, but how prepared are you for your future healthcare needs? Joining me is Stephanie Downs, Oncology Social Worker with the Cancer Care Center of Hardin Memorial Health, and Carol Waldemayer, Patient Advocate with Hardin Memorial Health. Carol, let's start with advanced planning. Why is that so important with our healthcare?
Thank you, Karen, and we do appreciate this opportunity so much to talk about advanced care planning. For over the years, we have been celebrating National Healthcare Decisions Day, and we look at that as an opportunity to teach and educate people about advance directives. But it is so important that, especially in this day when we are so busy, to take time and contemplate what your wishes would be. At that point, if you are unconscious, either temporarily unconscious or permanently unconscious, or if you have a terminal condition that there's not a cure for, to take time and contemplate what your wishes would be at that time. It's a very vulnerable situation. We know in this day and age that things can happen, a tragic accident or a diagnosis of a terminal disease, that you have thought about what your wishes are and how you would want to communicate that with your loved ones and with your physician. So I encourage you to really take that time to contemplate, reflect, and put the power back in you. It's a vulnerable situation, but make it a powerful situation where you are sharing what your wishes are.
We've heard the term advanced care planning. What does that entail as far as involvement in the types of advanced care planning that we need to think about?
Okay, definitely. And with our Kentucky law, we do look at advance directives, and there is a living will legal document that comprises your wishes and lets you select who you would want to be a healthcare surrogate for you to make healthcare decisions in the event that you are unable to speak for yourself, if you are temporarily unconscious or permanently unconscious. And it also looks at your end-of-life wishes and lets you, again, take that power and time to say, I've thought about this, and let your family know and your physician, this is how I would like for you to proceed at that point at end of life, whether you would want to prolong life by being on a machine or a ventilator, or have artificial feeding through a feeding tube in the stomach with artificial food and water, and if you would want to be an organ and tissue donor.
So who actually needs to think about advanced care planning?
We all do, Karen, and I encourage each of you to really take time and think about that. It is never too soon to go ahead and think about and complete a living will. These can be done very quickly, less than 10 minutes. Definitely we're able to assist people in completing those in the Patient Advocate Office at Hardin Memorial Hospital, and to go ahead and get that done as soon as you can.
Mm-hmm. Now, Stephanie, I know in your situation you might be dealing sometimes with individuals that are not able to make their wishes necessarily known. What happens in the state of Kentucky with individuals that are not able to maybe communicate their needs?
In the state of Kentucky, we have a list that we follow. We look to see if they have a legal guardian. If that is not the case, then we look to see if they have a living will that says that they have a healthcare surrogate or a healthcare power of attorney. If that is not the case, then we look to see if they have a legal spouse. If that spouse, if they're in the process of a divorce, if it is not a legal separation, that spouse still makes medical decisions for that individual. If they are divorced or single, then we look to adult children. And it is a majority rule. So if there are 3-4 children, those children together then make those medical decisions. If there are no children available, then we look to parents if they are available. Then it goes to siblings, and then any other children, any other relatives that we can locate. And sometimes there are individuals, say there's a situation where there is a separation involved, the spouses are in the process of divorce, and they do not feel comfortable making decisions. They have that right to say, I don't feel comfortable doing this, and, they can say, I don't want to make these decisions, and we just go to the next in line.
This has been Health in the Heartland, and we encourage you to have a conversation with your loved ones and your healthcare provider about your medical decisions. For more information, go to www.hmh.net.